I'm Lori Sigurdson, and I am the Alberta NDP critic for mental health and addictions. And I'm here with Janice Irwin and David Shepherd, MLAs where really the issue is pretty acute in your community. So thank you so much for standing here with us today. Thank you so much for the invitation to be part of this event today. And I also just want to acknowledge MP Heather McPherson is here too. I offer my deep and sincere condolences to all of you who are mourning the loss of a loved one, not just today, but every day. I'm heartbroken at how many Albertans have died of preventable overdose in this crisis. And from what frontline workers tell me, things are only getting worse. Alongside the grief for the lives lost is anger, because so many of these deaths are preventable. Yes, for sure. So many of our children, parents, siblings, friends, neighbors, and colleagues would still be here with us if they had access to life-saving healthcare services. I'm disgusted that Jason Kenney and the UCP are making those services harder to access. They're closing services and even fighting patients in court who just want to keep the treatment program they already have. Here's the bottom line: harm reduction saves lives. There's a mountain of scientific evidence to prove this, from Alberta, across Canada, and around the world. But many people here today already know it from their own lived experience. Our NDP caucus has called for an emergency plan to save lives. I was proud to stand with Moms Stop the Harm to call for an urgent expansion of the supervised consumption sites for widespread access to testing so people can know if their substances are lethally toxic. And I call for safe, legal, and regulated pharmaceutical alternatives for Albertans who use highly toxic street drugs. We know these measures will save lives. We are losing more than 4 people a day here in Alberta, and that is simply unacceptable. The government must change course. I had hoped that the new Associate Minister, Mike Ellis, would take a different path than his predecessor. So far, that hasn't happened. But we cannot continue on this path. Losing more than 4 Albertans every single day to preventable overdoses is just not acceptable. So if you're listening, Minister Ellis, I call on you personally to take action and save lives. It's time to change course. Harm reduction saves lives. Harm reduction saves lives. Harm reduction saves lives. Harm reduction saves lives.
Thank you for that introduction. I think I'm going to hold this. I think I'm going to hold it. That's easier. Yeah. And thank you to all of you coming out. This is my 5th time speaking at International Overdose Awareness Day, and it's so hard. It's so exhausting. It's heartbreaking that we are still here asking for the same things, and yet it's so important to speak out. And this morning I had butterflies in my stomach. I thought, what if nobody comes? So I'm so blessed to see all of you, such a diverse crowd of people from so many places and so many young people. I'm especially so pleased to see many young people here and see so many Indigenous people among us, because it's really about the young people. My son Danny was only 25. He was only 25, and so many that we are losing are so young. He died in 2014, Danny. And the pain of that loss is with us every day. And one of Danny's good friends is here today. And he's actually helping us with this event, which is just amazing. We are collectively remembering that pain today, and it's important that we do that, because what my friend Angela from Mom Stop the Harm has told me, that if we as advocates, if we don't heal our pain, we cannot be effective as advocates. So it's really important that we get together and we heal our pain and cry our tears when we have to, but also speak up and take action. Danny, when he died, he was one of the early victims when fentanyl was not in the news. That came much later. Now more people are aware of it, but it seems like our politicians, the ones in power, especially in Alberta, they treat it as if it's a problem that doesn't exist. Actually, it's worse than ignoring. They make the crisis worse with every action they take. When Danny died, there were 12 people every month who died. And I thought, 12 people every month. I read the obituaries. I cried tears for them and their families. Now, 12 people die every 3 days. Every 3 days in the province. And still, there are many people who don't even know how bad it is. It's a carnage. This morning, we get reports from BC. In the first 6 months of this year, 1,000 people died in British Columbia. Imagine that. And we have the same kind of numbers from across the country. What makes it harder is, and others like Ginetta pointed that out too, what makes it harder is that we know the solutions. This is not some kind of virus that is taking people and we don't have control over it. We have control over the solutions. We just need to acknowledge them and we need to implement them. The first thing we have to do is understand the problem. It's not an opioid crisis. And it's not an addictions crisis. It's a crisis of a poison drug supply. So what we need to do is, once we understand the problem, we can identify the solutions. The solutions are by addressing the poison drug supply, by providing safe alternatives and taking other measures to keep people safe, like supervised consumption services. We know that we first must keep people alive. Nobody here is against recovery. We have people among us who are in recovery, including Nick, who spoke earlier. But Nick also spoke of the power of harm reduction. Dead people don't recover. They don't recover. First, we must keep people alive, and then we can move forward. I was going to repeat our demands, the 7 demands of Albertans for evidence-based drug policy, because this event is a coalition event. There are many organizations, including our friends from AWARE, from CAPUT, the Canadian Association Who Use Drugs, and each and every, and we have Bear Claw here that did our patrol as we're walking. So it's many organizations. We have them listed on our website, and also our demands. We base our demands on 12 acts of violence that the UCP has committed against people who use drugs. And those 12 acts of violence include cutting services and taking services away, like the SES, cutting addiction treatment for homeless men in Gunn, Alberta, moving the Addiction Recovery Center out of town. It's by making policy changes that harm people, like the proposed changes to consumption sites where they ask people to have their name and healthcare number recorded. Each and every one of these acts is an act of violence against people who use drugs and their friends and families. We have to remember that. These are drug policy failures, and what we have as a result are drug policy death. So other speakers before me have named many of our demands, so you have heard them. I will not repeat them now, but key among them is to get safe supply and to expand harm reduction. Has anybody seen Jason Kenney? Still not, eh? He's a bit like Waldo these days. But Jason Kenney thinks he can hide from COVID and his other failures, but he can't. Even if he doesn't show up, even if he doesn't say anything, we know what he and his government have done. So we need to hold Jason Kenney and his crew accountable, and we will not be silent. What I also want to say is that for us as moms, we've been polite, we've been kind, we've been understanding the way people expect moms to be. But I tell you, we're done with that. I don't want condolences from politicians who do the same kind of crap the next day. I'm done with your condolences. No more thoughts and prayers from people who don't care and contribute. So what we are doing now, our new slogan is, "No more Mrs. Nice Mom." We are done being nice. We're doing different things. Yesterday and today in British Columbia, our sisters gave out safe supply. This is an initiative. It's led by the Drug User Liberation Front, and they got the safe supply because we don't really know where to get it. But anyways, we will find out. We help distribute it in an act of defiance, in social activism, in an act of protest, and to show that safe supply given out by people who understand the problem in a safe manner will save lives. So that's what's happening. Thank you to our friends in British Columbia. Our friends in Manitoba, they have taken to starting unsanctioned overdose prevention sites. They're participating in that. So it's great to see overdose prevention moving into Manitoba. Thank you for that. Here in Alberta, Mom Stop the Harm is taking the government to court. I mentioned that earlier. I signed on the dotted line to our affidavit. I don't know if my lawyer is here. Is Avnish here? I'm always feeling protected when my lawyer is in the crowd. He's not just my lawyer. He's for Lethbridge Overdose Prevention Services and Mom Stop the Harm together. We're taking the province to court, not because I wanted to take my province to court, but because we tried every other avenue to explain to them that the new regulations for consumption sites they put in place, including requiring healthcare numbers and names, will drive people away from life-saving services. I talked to Ophelia last night at a kickoff event and asked her, so when you started using consumption sites, what would have happened if you had to give your name and healthcare number? And she said, I was afraid of going there in the first place because I thought I'd get shitty treatment the way I do everywhere else in the healthcare system. People who use they expect to get shitty treatment in the healthcare system. And if their first interaction is asking for a healthcare number, they're not going to go, or they're not going to stay, or they're not going to come as often. And what happens? We know what happens use alone. When people use alone, we have too many die. So that's why we're taking our government to court. And if you want to support that, write to your MLAs, let them know how you feel about these new regulations. We also have a website. Two small organizations, we don't have a legal fund, so if you can help us fill our legal fund, that would be good too. What is important to know that every drug poisoning that is prevented from happening, every drug poisoning that is reversed, is a family and friends that don't have to arrange a funeral. I had to arrange a funeral. My husband Rick, who's with me here today, we had to arrange a funeral for Danny. Other moms, I know, I see faces in the crowd who had to arrange funerals for family and friends. It's not easy. It's not something you want to do. So that's why we have to focus on our solutions and save lives. I do this for Danny. I feel he's here for me, and you have different reasons why you're here for somebody who means a lot to you. I also look at my friend Lori over here. Lori, actually, we are here today because Lori said a few months back we should have a big event in Edmonton for International Overdose Awareness Day. So thank Lori for that. And her son Michael, who's here. Michael is a young man living in recovery because of the connections he made through a consumption service. So let's remember this, the people we are here for, the people we lost, the people we're helping, the people we're trying to move forward with, because International Overdose Awareness Day is not just a day to remember, it's a time to act, and it's upon all of you to act. Thank you.